The purpose of today's videos is to look at the person who's experienced early childhood trauma, abuse, neglect, being in a home with physical violence, moving around a lot, having different caretakers, abuse in the community, racism, poverty, observing community violence. And then that person grows up and becomes a parent. We're looking at here, how do we help the person who is a trauma survivor who is a parent in the best way? And the best thing for us to do in order to do that is to understand specifically how the experience of trauma affects becoming a parent. This information is adapted from a parenting resources handbook written by Karen Sock-Whitney, who also wrote our Risking Connection manual. And I highly recommend downloading this. This is the manual that Kay helped write, and that is the basis for the training that I do. So some of the material is also adapted from this. So what are some of the challenges for survivor parents? What makes it particularly hard to be a parent if you're a survivor of child abuse? What have you heard from people you've worked with? What do you know from your own experience? This would be where we would have a discussion of this, and things would come up such as lack of a good role model, skills that weren't learned, a sense of shame, a sense of not being good enough, not having an overactive body. This is what we'll go into in this class. We're basing our thinking about the parent as trauma survivor on our Risking Connection framework. In other words, we're going back to this basic roadmap of understanding what happens with trauma, how disrupted development affects a person in three main ways: attachments, relationships, their body and brain, and self-capacities or skills that they do not learn as a child. Specifically, the ability to make a connection and then use it to help you when that person isn't physically present, the sense that you're worthy of life and worthy of the air that you breathe, and the ability to recognize and manage feelings. Because our basic theory is that if your development has been disrupted and you've had disruption in all these areas, then you have a current stressor. The current stressor, instead of just being seen as the stressor of the moment, plunges you into a hole of despair, of hopelessness, of feeling like everything is your fault and it's always going to be this way. Intolerable feelings which no one can stand. So you do something to relieve those feelings. You do something to make yourself feel better. And the fact is that this is where all the symptoms we talk about come in: hurting yourself, hurting others, threats, destroying property, running away, drug and alcohol use, etc. All those things come in, and the fact is that they help. They help in the moment. However, they have negative long-term effects, some of which can be around parenting. So some of the ways that the person has learned to cope with intolerable feelings can get in the way of them being a good parent. So we talked a lot about how attachment is a central part of being a person, and that we all grow through relationships, and that relationships are how we manage distress and hard times, and that people who've been hurt in relationships are very understandably more suspicious of relationships, having difficulty connecting, not trusting others, expecting to be hurt and to be left. Well, then you think about being a parent. Some of you watching this video are probably yourselves parents. Whether or not you are, think of it this way: how much help does a parent need from other people? It's much easier to be a parent if you have friends. We all know that old saying about it takes a village. So who do you need as a parent? You need people who will help you think through the dilemmas that come up. You need people who will help you with the emotions that come up. You need advice. You also need practical help, like someone to pick the kid up from daycare when you're held late at work, or someone perhaps to help you financially. Then there's the fact that being a parent itself brings you into interaction with a lot of people. Because you're a parent, you have to interact with teachers and doctors and nurses, and you have to interact with the parents of your kids' friends. It puts you in a different relationship with your own family. It brings you into a different relationship with neighbors. Being a parent itself brings you into relationship with a lot of people. So naturally, if your assumption is that people are going to hurt you, that affects these relationships that you form because you're a parent. So for an example is school. If you yourself had bad experiences in school and were unhappy there and in pain when you were in school, and you have to go in for a parent-teacher conference because your child is in school, you will approach that meeting with great fear and trepidation. You will expect it to be bad. You will expect it to be blaming of you, to be a situation in which your own inadequacies become clear. What you'll expect to hear from the teacher is that you've done a bad thing as a parent, and that's showing up in your child. You may be so caught up in these expectations that you don't even hear what's really said, or it may affect your behavior towards the teacher. So this is an example, but this applies to every relationship that you're brought into as a parent. It's affected by your experience with relationships. So if we look at the framework again, we can remember that early childhood neglect and abuse affects the biology of a person. It actually changes the brain, and it actually changes the nervous system and the whole digestive system. The body is affected by early childhood abuse and neglect. We can see this clearly with modern instruments. Remember, we talked about the human danger response, how when we're in danger, we're hyper alert, very focused, unable to sleep or relax. Our body starts changing and raising our blood pressure, etc., in order to fight or flee, to prepare for a danger. But if you've had a lot of early danger as a child, you're always expecting danger, and you stay in that hyper alertness place. You're always afraid that something's going to go wrong, that someone's going to hurt you, that something bad is going to happen any minute. So you have trouble relaxing, playing, sleeping. You have intrusive thoughts about bad things that either have happened or are going to happen. And then another part of this, the way that early childhood abuse affects the brain, is that the part of the brain that does executive functioning, that it is not well developed. What does executive functioning mean? It means the ability to plan, to think about the future, to put aside what you want at the moment in favor of a future goal, to be able to be self-observant, to do things like plan your shopping for the week. Now let's just think about these various things and how they relate to parenting. As we know, parenting itself is pretty stressful and can have periods where it's especially stressful. But what if you're always on guard and always jumpy already, and then you have a crying baby that you can't figure out how to soothe? When you have a baby, it's hard to get any sleep because the baby may not be sleeping. But if you have trouble sleeping anyway, and then you add that on top of it, you can really end up with a sleep-deprived person. Playing and relaxing and having fun is a key element of parenting. It's a lot about how the child learns, and it's also important to restoring and growing the relationship. It's like food for the parent. It's like what sustains them through the difficult time. If the parent can't relax, can't play, can't have fun because they're so tense and always on edge, that takes away a huge and important part of parenting. Intrusive thoughts, dissociation, flashbacks can get in the way of being attuned with your child. That can get in the way of having fun with your child and also having those attuned relationships that are essential for building the child's brain. And then, of course, if we give a moment's thought, we can see that parenting takes a lot of executive skills. You have to do a lot of planning, thinking, being organized, and putting aside the joys of the moment for the long-term goal in order to be a parent, a good parent. if you're not very good at that kind of thing, it can really get in the way of your meeting the child's needs. Finally, let's look at the skills that a person who grows up with attachment disruptions and physical abuse and in situations of violence does not develop these skills. These things are these skills that we all use to get through the hard times of life are essential in being a good parent. These are the main skills we're talking about: how to make connections and remember those connections when the person isn't there, the sense of yourself as worthwhile, or the converse, the sense of shame and worthlessness, and the ability to recognize, name, modulate, and understand emotions. You can see where any of these things would be central to being a parent. And one of the most important ones is the element of shame. We all tend to doubt ourselves as parents, and there's many times as a parent where the right thing to do is not clear. Everything from as simple as, my kid has a fever of 102, should I take him to the emergency room, or is this normal? To my kid is 15 and wants to go overnight to a friend's house, is that a good idea or not? Or when does my kid get a smartphone? To what do I tell my kid about sex? All these things are things that are hard to decide as parents. Parenting is full of difficult decisions. If you have a sense of yourself as worthless, as less than, it's very likely that you'll fall into thinking that whatever is a struggle with your child is your fault. And you imagine that any other mother knows what to do, that you're the only person who's struggling with this. And this interacts with the problem in relationships. If you feel like whatever's going wrong is your fault, then you also would be reluctant to call anyone to talk it over, because you'd be sure they'd say, what? How stupid of you, don't you know the answer? So just take the crying baby that you can't soothe. The person who felt shame and worthlessness would be feeling that this crying baby was crying because of them, and that a good mother would know what to do to soothe this child, and that every other mother in the world does know that, whereas we know, of course, that many babies are hard to soothe. And that person would be afraid to call, say, their friend and say, this kid has been crying all night, he's driving me crazy, what can I do? And get some practical suggestions, because they would expect from their friend a message of blame. What? You don't know how to calm down your own baby? What's wrong with you? Is the message they would expect. So they wouldn't call. And in that case, they'd be alone with this pain and difficulty and not knowing what to do. They'd start to feel all sorts of intolerable feelings and might turn to something that is helpful in the moment, but makes the situation much worse, like, say, drinking, or just leaving the baby alone, or any number of things that might make them feel better for a few minutes, but in fact would be bad for both them and their baby. The core of trauma-informed care is that we believe that all symptoms and behaviors are adaptations. Every single thing someone does is the best that they know how, what they've learned to cope with intolerable situations. Every single thing is someone's attempt to solve a problem, someone's attempt to deal with some emotions they're feeling. Every piece of behavior makes sense if you understand someone's entire story. So every bit of parenting that we're horrified by, or that we're worried about, or that we see as dangerous to the child, is that parent's best effort to help their child. They don't set out to hurt their child, they set out to be a good parent. And when they do something that we see as dangerous or not effective or not optimum, it's because that's the best they know how at that moment. The parent may be overcome by guilt or self-blame. The parent may feel frightened for their child. The parent that's yelling at their child or even hitting them to keep them inside may feel frightened because of what they've experienced in the world outside their home, of how dangerous it is. There's always more to it, and more that you can find out about what that parent was trying to accomplish, where they were coming from, what they were feeling at the time. As you begin to understand this and work with the parent to find out what's going on beneath the surface, that's when you can come up with effective help. Effective help would be something that would meet those same needs in a way that was not dangerous in the moment, or not dangerous to anyone, not harmful to anyone. A way to solve the same problems, meet the same needs in a less dangerous way. So when we interact with parents this way, understanding that they're doing the best they can, we're understanding that they have strength, that they themselves were in horrible situations and they found the best way they could to survive, and that's what they're left with. They're left with behaviors that were necessary for them as children to keep them alive, but may not be working well at this present time. But if we respect the behaviors, if we respect what they had to do to cope, and help them to understand how those behaviors are helpful to them, then from there we can work towards, well, what else could you do now? It also helps us understand that it's not because of us. It's not personal to us. It's not even personal to their individual child. It's a sum of everything they've grown up. The parents who are trauma survivors are already shameful and blame themselves. They've probably also interacted with professionals who have blamed them, whether those be therapists, doctors, school personnel, or whatever. So they've experienced people holding them responsible for their kids' problems and not treating them with respect. So that's what they expect from you. They expect to be blamed, to be shamed. And if you, in fact, react to understanding they're doing the best they can, helping them to understand where their behavior came from and what it needs it's meeting, help them explore the behavior before you even try to change it, it'll be a different and new experience for the parent. It'll make you and the parent an allies. You're standing beside them. You're on their side. You're admiring what they've done so far, and you're there beside them to listen to their pain, to understand the difficulties for them, and to gradually work together to find other ways. It starts with your believing in your heart that at that moment they're doing the best they can. As we've heard before, a lot of times trauma is diagnosed many ways. People who've experienced severe childhood trauma usually end up with a whole list of 6 or 7 diagnoses, and can experience the symptoms of many mental health diagnoses. And of course, those diagnoses, or rather those symptoms, get in the way of parenting, like depression, of course, makes it hard to take the actions that you need for your child. Anxiety, PTSD with its symptoms of intrusive flashbacks and dissociation very much interfere with the attunement with the child and with the relaxation and fun with the child. And then there's all the stigma with mental health problems. There's also the complexity of taking medication. So the mental health issues interact with the trauma issues to also make it harder to be a good parent. The parent may have developed strategies, as we said, that make sense, that were their way of surviving essential things. I mean, horrible things that happened to them. They need a way to survive, and they've developed these strategies, but they don't work with being a good parent. They get in the way of being good parents. Addictions are a primary example. A person may have learned that drugs, that alcohol is a way to survive the horrible feelings that they have inside. But of course, those get in the way of parenting, and we've mentioned dissociation, self-injuries. Another example is a parent who themselves has no sense of interconnection. That is, they don't have a sense of people who care about them that they can think about when they're in difficulty, people whose kind voices are in their mind. Instead, when they're alone physically, they can't think of anybody who loves them, so they feel desperately alone and frightened and as though they were exiled. A person feeling like that is likely to settle for any relationship in order to have some relationship. That gets together with the lack of self-worth, feeling like you don't deserve any better, that you'll never get any better relationship because you yourself are no good. All of these things combine together to make the person who's had early childhood abuse very vulnerable to getting into destructive relationships. Relationships in which they're beaten, relationships in which the person doesn't treat them with respect, relationships in which the person joins them in addictions and other harmful things. Naturally, those type of relationships get in the way of parenting, in fact, can sometimes provide danger for the child, create danger for the child. If people can be in and out of the house, people can hurt the child. So, that desperation for any relationship can result in real danger for the child. So let's remember the basic principle here that we can't just tell a person, whether they're a parent, a child, or anybody, okay, that what you're doing, it's bad. It doesn't work. It has this and that and the other negative consequences, so stop it. We can't teach a parent 16 parenting techniques and tell them to stop doing that other thing they're doing, start doing these techniques, until we understand what need is being met by what they're doing now, and we can work with them to find other ways to meet that same need, to take care of themselves, to manage their flashbacks and dissociation, to manage their horrible feelings, their sadness. Until they have better techniques, they can't give up the old techniques any more than we can. The same thing applies for us. You could learn everything there is to know about dieting and what are the best foods and what's wrong with overeating and what's wrong with being overweight, how it can cause diabetes and all these other things. You could be able to write a book about it, but you couldn't do it until you understand what function has overeating had for you? How has it helped you? How has it been a good thing for you that you've used when you needed it? And then learn how to comfort yourself in other ways. That's when you could give up or decrease overeating. The same applies to everything we see with parents. So it really helps us in working with a parent to, with them as partners, understand the adaptive function of the behavior. And then once we've explored it thoroughly and we have an alliance with the parent, then we can talk about what would the parent need to change? What skills would they need to learn? What experiences would they need to have? What relationships would sustain such a change? That's what we would be working with the parent to discover. One of the things that's part of change is to learn that the present is different from the past. We learn our earliest coping skills when we were children. For instance, a person may learn to dissociate, that is, space out and feel like they're not in the situation, that they're just watching it from above. They learn to dissociate because they are in a situation where they're being hurt. They're a little child. They can't run. They can't fight. They have no power, and they're being abused. That dissociation keeps them alive, gets them through the moment. But now that they're an adult, if someone was trying to abuse them, they could run, they could fight, they do have resources. But they might be so used to using dissociation as a way to get through difficult times that they don't even notice that now they have other options. And that's what part of what our work is, to help them see what's different now from when you were 5 years old. What resources do you have? Who do you have on your side? What have you learned and what have you developed as you've grown? Who are your advocates? These are, as you begin to see these resources and understand you have more power now, you can try other things. That's what will help sustain a change, and especially having relationships that you can depend on to help you change. So what can we do to help? Well, that'll be part of another segment, but basically to be respectful to the parents, not to blame them. Model for ourselves model ourselves in our relationship with them, the kind of relationship we hope they will have with their children. We also can actually give them some education, some information about the stages of child development, how to discipline, lots of things about being a parent, and also where to find support. Where are resources? How can they connect with other parents that are struggling with the same things? That can be very, very powerful. Sometimes a parent will feel upset and angry about something a child's doing, and it'll be very helpful for them to know that that's really normal for that age. So offering that education and support, and it's so healing to be able to talk to other parents and find out that, guess what, it isn't easy for anybody. Everybody's struggling. There is nobody who has all the answers. That can be a huge relief for a survivor. So to summarize, trauma survivors who are parents have had difficulty in their own relationships, so they find it hard to ask for help and to trust those with whom being a parent brings them into relationships, doctors, teachers, etc. It's hard for them to trust them because they've been hurt by people in authority. Since they live with a constant sense of danger and an activated body, that can be made worse by things that happen within parenting, like a child crying or a child not coming home on time or whatever. If the parent themselves feels worthless and shameful and blames themselves for they can blame themselves for everything that happens with their child, and because of this also finds it hard to ask for help because they're sure that the person will see the problem as something they've created. They also don't have soothing voices and kind memories to help them through hard times, or they haven't learned the skills of naming and recognizing and communicating their own feelings so that they can take action to soothe themselves before their feelings get out of control. So instead of sending trauma survivor parents to parenting classes, what we need to do is help them learn these skills, help them have positive relationships with others, help them learn to soothe their own bodies, and then their parenting will be able to improve. And when they've learned these skills and are in a calmer, safer, more connected place, then they can be able to learn some specifics that we could teach them.